Good afternoon and welcome to this webinar. My name is Terry Savage. I am a vice president at Westat and president of the Society for Health Communication. And I want to thank you for taking time out of your busy schedules today to join us for this critical discussion. I'd like to say a little bit about the society. Next slide, please. We are a member-driven organization bridging the gap between public health, healthcare, digital health, academia, and research. We envision a united group of health communication professionals whose collaboration improves health initiatives' impact to advance public health. And as such, these types of conversations are crucial for us all to truly make a difference. The Society is now 3,000 members strong, and we encourage anyone on this webinar who is not already a member and is aligned with our mission to join. Membership is free. Next slide, please. I'd like to say a little bit about Westat. Westat offers innovative public professional services to help clients improve outcomes across a variety of topics. We are more than 1,700 professionals dedicated to improving lives through research and communication. We are headquartered in Rockville, Maryland, with offices around the country and internationally. Today's discussion features a panel of talented professionals and a conversation that we hope will get us all thinking about how we can impact health equity and health disparities. Moderating our discussion today is my colleague, Belinda Gaston. Belinda is a principal associate at Westat and a strategic communications and public health partnerships expert with nearly 20 years of experience leading public health programs. She works with federal agencies, state and local health departments, and nonprofits, providing strategic planning, partnerships, community engagement, and training and technical assistance. Belinda, the floor is yours.
Thank you, Terry. So we are excited to have you here. I must say I'm very happy that so many people were interested in joining us today. We capped out at our max registration of 500 people. And so that just means that this conversation is incredibly important. So before we get started, I wanted to give you a few housekeeping things just so that you'll know what's going on. And so as you're coming in, and I see that people are still coming in, as you're coming in, you'll notice that you have been muted upon entry, and we have tried to ensure that videos are off for most people who are joining. Even though your phone lines have been muted or your computers have been muted, we do have the chat feature active, and we really want you to participate in the chat. So take a moment and drop a note. Let us know who you are, where you're joining us from. And as our panelists are going through our discussion today, if you have comments or questions, please put them in the chat, because the conversation is not a conversation without you. So it's really important that you do so. So please use the chat. Also, we've received already a few questions from people who have asked if we'll be recording this session. And so we will be recording the session. The video will be available after this session on the Health Communication Society webpage, so that those of you who have either missed portions of it or want to go back and review it, you'll be able to do so. And then finally, we received so many questions. Again, I said that we had 500 registrants for this webinar. We received so many questions that we won't be able to get to all of the questions. We only have 90 minutes. And so we'll do our best to share additional resources and tools, and we will continue this conversation and have future discussions. And so we'll do our best to address those. So if your question isn't addressed right away, it will be eventually. And also we'll have some time at the end for questions and answers. So for your questions and answers, if there are questions specifically for the panelists, we'd like for you to put them in the QA tab for us. And for the chat feature, again, engage with us, because the conversation is not the same without you. So again, welcome, welcome, welcome. I want to take a moment to introduce our wonderful panelists for our session today. And so I'll start first with Kim Blessing. Kim is amazing. Kim is the vice president for Kaufman and Associates for communications, and she has more than 13 years of experience developing communications programs related to education, public health, safety, and support for vulnerable populations. Right now, Kim oversees various federal and private outreach projects for KAI. And KAI, by the way, is an American Indian and woman-owned firm dedicated to improving the lives of vulnerable populations, including ones designed to increase participation of American Indians and Alaska Natives in Centers for Medicare and Medicaid Service Programs. So welcome, Kim. Kim, you can just wave for us. Excellent. Okay, next up we have LaTroya Hester. LaTroya is the Director of Communications at the Center for Black Health and Equity. LaTroya has been there for some time, and the Center for Black Health and Equity is a national nonprofit concerned with health equity and improving African Americans' health outcomes. She currently manages events and communications for the Center for Black Health and Equity, and the upcoming State of Black Health Conference, National Conference, is coming up next week, and No Menthol Sunday. As a passion project, LaTroya also runs Media Woke, a media literacy program for the church, and she's also founder of Comms Noir, a new membership organization for communicators of color. Welcome, LaTroya. Okay, next up we have Leisha McKinley Beach. Leisha is a national HIV/AIDS consultant, founder and CEO of Cush Health Impact and Leisha.org. And she serves as a consultant on HIV and other health issues that affect Black communities, specifically Black women. Earlier in her career, Leisha was HIV prevention program manager for Fulton County for their Department of Health and Wellness. She was director of technical assistance and stakeholder engagement for Black AIDS Institute and HIV prevention director for the Georgia Department of Community Health. She was also a prevention program supervisor for Florida Department of Health, and she's developed and launched an HIV testing initiative. She oversaw the development of Atlanta's HIV prevention plan, and she engaged faith-based communities in the HIV response. So Leisha, welcome. And rounding out our panel, we're excited, is Jose Lopez Zamorano. I think I said that wrong, Jose. Jose graciously filled in. I think most of you were expecting Allison Rodden, but she had a schedule conflict. And so Jose is filling in for us. And I think that it is amazing that he's doing so. It's a pleasure to have him. He is the Vice President of Creative, Messaging, and Production for the Hispanic Communications Network. He specializes in culturally driven creative messaging and digital traditional production elements that speak to the hearts and minds of Hispanic audiences. He has a large health portfolio within HCN's social and health marketing practices, where he leads development in culture and in language digital, social, radio, video, and earned media messaging and materials for government, nonprofit, CSR, and private foundation clients. Jose is well-known and credible voice for U.S. Spanish-speaking communities. He's known as the voice of the people. He has over 30 plus years of experience as a multimedia writer and journalist, also a reporter and a radio personality. So welcome, Jose. Excellent. So thank you all so much for being here. We're going to jump right into our discussion. This conversation is really intended to talk about how we can communicate about health disparities to impact health equity. And not surprisingly, we had a lot of interest in this particular conversation. What I'd like to start with is just asking our panelists, why do you think this conversation and others like this are important to have? And why should we be having them now? And I'm going to pick on Leisha first to start our conversation. Leisha.
I was feeling that vibe, Belinda, that you was coming down my lane. Again, thank you, Westat, for having me to be a part of this conversation. And I think that so much of what we have experienced or witnessed with COVID, and I know we'll talk a little bit more about that later, but we have a public health issue that has become prime time. And there are some lessons learned around the communication and its effectiveness and lack thereof, quite honestly, within, for everyday citizens. And so having a platform to really be able to dive in and talk about what were some of those misses, but also what were some of those powerful moments that, help make COVID real for individuals.
Thank you. Any of our other panelists would like to participate in this question?
Yeah, I'd like to say that you make a really fantastic point, Leisha, and it's certainly on the money. I would also add that right now, with the whole country having this sort of racial awakening, people are starting to believe what has always been said about the disparities that exist in the country, not just around one specific health issue, but across the board. So whereas people were previously kind of accepting this idea that racism was about lynching or segregation, people are now starting to understand, believe, and be aware that racism often can look like HIV rates in the white community going down while they're still going up in the Black community. Or it can look like not being heard or taken seriously when you're in pain, or if you are a pregnant mother and you're talking as a Black woman or as a woman of color and you're not feeling like you're being heard. Like, these are forms of racism that people are now seeing as racism. And so they see that, connection now with health disparities as something that needs to be addressed urgently.
If I may say, I totally agree. I think this conversation is not only relevant, but it's vital, because all of us know that our communities of color are being disproportionately affected by COVID, not only health-wise, but also economically, with more hospitalizations, mortality rate. And most people know that, yeah, they are essential workers. They don't, they are in a higher risk, but sometimes I believe there's not a widespread awareness about how social determinants of health are really impacting our communities. The fact that many times it's not just a personal choice to keep the distance, if we live in, let's say, multi-family, multi-generational households, if we have to work under certain conditions, for example, in farm working areas, in meat packing industry, we don't know if the employers follow the rules and the guidelines of everybody. So to me, this kind of conversation, we create this sensitivity as to that, yeah, we've been disproportionately affected, but it's not because we're not following the rules. Sometimes it's almost impossible to follow the rules because of our own economical and socioeconomic circumstances. So to the extent I believe that we can, create this sensitivity about what is going on with our communities right now with this pandemic, I think these conversations are terribly important.
Yes, I definitely agree. And at KAI, we work with American Indian and Alaska Native populations, and they are disproportionately affected by the pandemic. The death rate is 2.6 times more than white populations. And, the numbers are devastating, but, we also, at KI, we have the majority of our staff are tribal community members, and it's daily where we're hearing about people who have become sick, hospitalized, have passed away. And it's just, it's just devastating. So this is, it's definitely important to have this conversation because it will literally save lives. If we take those lessons learned and we are communicating effectively, our work does save lives, and it's important to always remember that.
Thank you all for that. And as we're talking through, we're hoping to be able to give folks some lessons learned and some tools or resources or things that they can do as they are kind of addressing this issue. One of the things that I feel very passionately about is, we talk about communication best practices for health disparities, but and kind of what those messages should look like, what they should sound like. But I really believe that all of this begins with the choices that we make. We have a choice to include communications planning at the beginning of all of our projects, even if we're doing evaluation projects, right? We have the choice to be intentional with the terminology that we use, with the words that we choose. It's all a choice. And we also have intention. We can make the choice to be intentional about who's at the table, right? When we're putting together these advisory groups or making decisions, we have a choice for that. And so I think that it's all about choices. So I want to ask each of you to tell me what you think is the biggest choice that we have to make in health communications. And really the choice that we have to make to positively impact health equity and decrease health disparities. And I'm going to pick on LaTroya first to start our conversation.
Sure. Okay. So I work for the Center for Black Health and Equity, and I have often, our organization is often on the wrong end of this. So let me try to explain. A lot of times when people are getting ready to put together a communications campaign that is specifically targeted for African American communities, it's just like you said, Belinda. They will go forward with the research. They'll develop the whole plan. They'll put together all the creative. They'll put thousands of dollars toward recording and graphics and video, and then they'll call us when it's all done to ask for our stamp of approval. And so, on the one hand, it can be a little insulting because, we will, of course, be active partners by consulting and giving our opinion. But the fact is, once you've created the campaign, it's really too late to ask for our opinion about how do you think this will be received in the Black community? How will this be relevant to African Americans? Because at that point, it's already set in stone. You're really just doing this as a formality. And so I guess for those of us who are creating these campaigns, whether you're doing them, I don't know if those who are in the audience, you work for organizations that are majority white or reach the general population, but when you have the opportunity to reach priority populations, Latinos, LGBTQ, African Americans, our Native American brothers and sisters, what you have to do is bring us to the table at the beginning, like from research. So when you're collecting the insights that you need to actually develop your messaging, you've got to ask not only the experts, but you've got to ask the lay people because they actually know what's going on. You have a choice about where you go to collect your data and how you collect that data. So I think that's really important when you're developing your messages, not to be afraid to use the words that you hear coming from your audiences. And on the end of our organization, and I have been in these tough conversations where we have to sometimes put our foot down when some of those majority white agencies come to us at the last hour and say, this is a choice. We cannot put our stamp of approval on this because we were not involved in the process. Now that's tough. It takes some guts, but I've seen it done. We've done it before. And we've basically saying, we are happy to be a part of, just give you our 2 cents, but no, you can't add our logo to that. No, we really don't believe this is the best way to go about it. And we'll offer our guidance, but we do have a choice on whether or not we co-sign on stuff. And I think another really important choice that we all make when we're getting ready to partner with folks and to do this work is to kind of rethink the usual suspects. So oftentimes our knee-jerk reaction, for lack of a better term, is to go to the big agencies, go to the big ad agencies, go to the big marketing agencies. And the fact is, a lot of times, not all of those agencies, but sometimes those, because I worked in a lot of them, they look a lot like the rest of the world. You don't always find great representation like you may find like at WestAt, where you have African Americans in leadership and you have people who are really making those creative decisions, who are actually the creative decision makers, who can actually talk about what actually makes it to the final product. So think about using boutique agencies when the opportunity is there, or actively partnering with boutique agencies if you're working with a large agency, and working with private consultants who reflect the audience that you're trying to reach.
Those are some great tips. Are there any other thoughts on this?
Yeah, if I may say, yeah, I totally agree with that statement, because now that we're working with two big campaigns regarding health issues with big agencies, it has been very positive for us to know that there are people that have the sensitivity to know that they don't know our community as well as we do. And so to the extent that we have been able to start from scratch, from the very beginning of the conceptualization of the campaigns, brainstorming the ideas, the messaging, I think has been very important. And we're very proud to see that many of the concepts that we brought to the table initially are now spread all over the place. Because I'm going to be honest with you, sometimes at the beginning, it looks like we live in different universes. It's not that it's a bad fate toward our community. It's just that we're so culturally different, and the nuances of our, for example, perception of the government, the authority, the trust in the physicians or the healthcare system is so different, and our personal circumstances are so different. That it's like we live in different, not only countries but eras, sometimes in different time and places. So to the extent that we can actually make a difference in trying to explain those differences, and that we do not only become like transcreators or translators of the big general market kind of messaging, to that I think we can really be successful in addressing the needs of communication for our communities. And the good thing is I think that people who work in this field are because are really people that care. So the good thing is that we found a lot of sensitivity about our approach, our ideas, and I think that's very positive, because what we like to work with is with this idea that we always need to be inclusive, especially for our communities, but we also need to be horizontal in the way we propose the communications. It's not that we're coming with a great message because we have the truth, but rather we're coming to the level of our communities, understanding their health literacy levels, and being learners as well as practitioners. We want to hear what you have to say. We want to know what are your needs. Yeah, we might want to tell you what you need to know, but we also want to know what you want to know. Do a lot of social listening to understand what the needs are in this specific moment, because in this time and age, and I'm a journalist, the news cycle was like a week or a month. Now it's in real time changing. Misinformation can travel fast. So we need to be aware of what is being said, when it's being said, and to the extent that we bring that kind of granular knowledge of our communities, I think we can be successful in whatever campaign we need to do.
I would also, I totally agree. And LaTroy, you said something that really stood out to me, was that, coming in at the end, we've been in that situation too, where we've brought in to approve something and we've had to say no, and that's tough. But also we've been in situations where we are at the table from the beginning, but we're talked over. So you may need to be really assertive when you do have a spot at the table to, get your point across. So we've been in that situation, and that is also tough, but it can definitely be done. And then, going, both of you talked about going to where your community is, and that is so incredibly important. We've, to get that, to talk to people at the beginning of campaigns, we'll go to community events, we'll go to powwows, and we'll set up focus groups, or we'll do interviews. I mean, we'll try to grab people and talk to them, right during the event. So there are ways that you can do, talk to people that are low cost and are easy, and you don't have to do a lot of recruitment and things like that, and really go to the physical space where your community is really important. And then we've also done, just for a concrete example, we had a project where we were doing marijuana consumption prevention with Native youth in Washington State, and we did a focus group with just moms and grandmas, and it was so powerful. And the information we learned just absolutely improved the campaign and made it that much more effective. So just kind of thinking about different ways to segment and talk to different groups within your population can really help as well.
I just want to add one little point to that, because of the beauty and the diversity of this panel. Another really important choice that we all have to make is standing up for one another. Right. So just because you're not a part of one in-group doesn't mean that we don't all stand up for each other. And I've also been in a position where I've had to say that, this is not going to fly in that community. I'm not a part of that community, but I'll bring someone over here to let you know because because these are my friends, these are my colleagues, these are people who are in my community, and they will give you the advice, but we have to also be willing to stand up and say, you know, this is not really the best direction, and let me point you to someone who can help you, who can help validate that. But when we have the chance, oftentimes we have to stand up for one another when someone from that group is not at the table. So.
Belinda, there's nothing else for me to add. I think, you know, my colleagues have given some true best practices, you know, just around the framing of this. One of the things, though, that when folks come to me about media, specifically as it relates to some type of health messaging in Black communities, I always ask, you know, what's the motive behind your story? Or what's the motive of the messaging? And you know, some look at me strange for saying that, but I need to clearly understand, you know, is this something that truly is about raising awareness or education within my community? Because as somebody who is respected, I'm ushering you in, or I'm making a statement, right, that is co-signing on this message. And once I lose that respect, I'm not going to be able to get that back. And so I need you to be honest with me about what is your motive behind this message or message delivery.
I just want to pause for a second, and I'll allow any of our panelists to keep talking on this before we move to the next question. But I just want to make sure people are capturing. These are some great tips, you know, to involve more social listening as we're doing this work, and making sure that the right people are at the table, and the people at the table have a voice at the table. And then, you know, making the choice to whether you as an organization or as an individual will go along with whatever the work is that's being created. We talked about kind of standing up for each other. That's that allyship. A lot of times, you know, we get caught up in focusing on, you know, our piece of the pie. Sometimes we forget that we're all in this together. And I think the pandemic has taught us that a bit, but I think those are all great tips. And I didn't want, you know, that to be lost. Before I ask my next question, I want to know if there are any other final thoughts on just kind of this idea of choices and the choices that we have to make. Okay, it looks like not. So I'm going to switch a little bit here. So I have been attending webinars like crazy because it's pandemic and everything's virtual, and it's so much easier to go and to learn more. And one of the webinars I attended, the panelists there talked about language and how language can empower communities, and how language can disempower communities. And I thought that was an interesting concept, especially as a communicator. You know, we look for words that don't offend, and we look for words to, you know, to say things right. But it is true that, you know, perhaps language can empower and disempower communities. So I wanted to know your thoughts on that. And I'm going to pick on Jose for this question. Jose, what are your thoughts on that?
Thank you, Belinda. No, absolutely. You know, language can empower or disempower communities. And I will start even before language. You know, I feel that in everything we conceptualize for our audiences, and I'm having a very hard time disassociating what we're producing because of the COVID pandemic with everything else. But, you know, especially this time, what I have in mind always before I write the first word is have this idea of dealing with respect and empathy as to what is happening to our community. So even before I write the first word of anything, I'm thinking, you know, about the hardships that our communities have endured, continue to endure, the long way that they have to, you know, suffer all these consequences. Myself having lost family members, close family members in Mexico, and friends that have lost their jobs and, you know, their businesses. So it's always this idea that if we don't start with the attitude of empathy and respect, especially compared to what happens before January, you know, it's very difficult to establish a real emotional connection with somebody, regardless of whatever language you use. So to me, in the case of our community, it is very important that we understand who we are, where we come from, a clear understanding of our health literacy level, in this case on health issues. We know that we face many challenges in that regard because we come from different countries, different traditions, but there is a lot of common ground too. So to me, always the challenge is to find that common ground in terms of being Hispanic, what it means being Hispanic. Many people don't even believe they are Hispanics or Latinos. They say, I'm not Hispanic, I'm a Latino, I'm Mexican, or I am, Guatemalan or Cuban, whatever. So this idea to me is the idea of the power of collective action, of collective responsibility. And to me, once you establish that personal and emotional connection about what people are doing and suffering and their aspirations, their goals in life, why they are here, what they're trying to do with their lives, how they're coping with the circumstances. Once you establish that basic level, I think everything comes kind of easy. Because to me, the most empowering thing that we have, other than language itself, the idea of collective action is the idea of giving our people resources. We always aim to give people, it can be a concept, a basic idea, it can be a telephone number, it can be a toolkit, whatever. We always believe that our community, because of the fact that we have around a 5th grade elementary level in terms of general literacy and a very basic health literacy level, we need to be very didactic, not to be condescending, but rather trying to be very informative in a way that is useful for whatever thing we're trying to do. And to the extent that we can do that, and we have in HCN the good luck to have a built-in, and we can talk about it later, a built-in network of affiliates that give us instant, immediate feedback. We know if we're going in the right direction or we're going in the wrong direction. But to me, everything starts with dignity, empathy, and respect for our audiences.
That's a great point, Jose. Empathy, dignity, and respect. That's very important. Any of our other panelists want to chime in here?
I will. I'll just chime in to say that our organization, for instance, we have to take advantage of resources that our partners utilize just to make sure that we are up to speed. So you never want to get too big for your britches, right? So because culture changes all the time, just because you have a Black friend or just because your friend speaks Spanish doesn't mean that you know everything about what's going on in that culture. So there's a really great guide that's put out by the National Black Justice Coalition. It's called the Language Matters Guide, and it's really focused on people living with HIV and also just what's now acceptable with LGBTQ communications. And so, in fact, the LGBTQ Journalist Society, I'm going to get their name wrong. I think it's the Journalist Association. They also have a language guide. So if you guys are interested in just understanding nuance about what changes, where, you have some communities that are very accepting of phrases when we're talking about LGBTQ, for instance, very accepting of phrases like queer or MSM or gay. You have other partners and friends of ours who are that lean more toward same gender loving, right? So that might be very unfamiliar to some groups. And so we have to think about the nuanced, use of language, because sometimes language, although it seems really common, can actually be very stigmatizing. And so it's really important just to be aware of those things all the time and take advantage of the resources that are available.
And those are two great resources. So again, that was the National Black Justice Coalition, NBJC, and we'll try to put that in the chat for you. Yeah. They have a language guide, and also the NLGJA.
That's right.
That's it. The NLGJA. They also have a language guide.
And that one's really important for formal reporting in the news. Yeah.
Mm-hmm, mm-hmm. And we'll do our best to get them in the chat for you before we're done. Okay, so we're going to move a little bit. We've talked about kind of the importance of this conversation. We've talked about language and the importance of language, but we understand as communicators that it doesn't really matter what message we create. If people receive those messages in a way that's confusing or offensive, or they don't feel included, the work is a failure. And so what we have to do is make sure that we are evaluating our messages that we create. We want to make sure that for effective communications, there's routine evaluations, there's checks and balances, just to determine even if a message is appropriate, right? And so we talked about some of those things. But I want us to kind of drill down a little bit and kind of, since you're each from different kind of organizations, I want to know what are some of the ways that you and your teams decide if health messages are accurate and accessible, timely, and culturally sensitive. What are those ways that you evaluate your messages? And I think I picked on everybody else, so I'm going to pick on Kim now. Kim, what are your thoughts on that?
I already talked about focus groups. That's really important. And we will assemble focus groups at the beginning, and then we'll create messages and products and then retest them. And focus groups, you can have them be very formal. It really depends on your budget. And we've also adapted to the pandemic. So we've done virtual focus groups over Zoom. So there's ways that you can do it where it's really formal. You can have a researcher there taking notes and coding, putting their software out there. I think Deduce is one of them. Or you could just have a conversation and you can pull out themes from the conversation. You can do it virtually over Zoom. You can do conference calls. You can do more in-depth interviews with people over the phone. So there are lots of different ways and at different cost levels to gather that information. And as I mentioned, we did the focus group with the moms and the grandmas, and we'll look at just different groups and different segments and do it that way. We also have a big network of subject matter experts. So, it's really important to make sure that your messages are accurate. And so we'll look at, depending on the project, we'll look at SAMHSA, we'll look at CDC, where's the science, where's the data? And then where are our subject matter experts? Because we work with subject matter experts who have been in the field for 20 years and have been through multiple presidential administrations. So they've got the data and the science there, and they will inform our campaign. And it is a challenge to take that, the feedback that you receive from community members and the evidence informed and combine that. But that's where it's really is interesting, and it's a really exciting process. And then we also make sure we have images that are represented, that our community is represented. So not only is it the messaging, but it's also the visuals. So if the people we're serving can see themselves in the products, that's very, very important.
Thank you for that. Others who'd like to comment on this?
Well, something I would say is,
sorry. Go ahead, Andrea.
well, I was just going to say, just from a more informal perspective. So our organization, for instance, of course, we lean on our partners. We have partners all across the country that are working at the community level. And so we can easily slide our messaging to them because they represent different regions, different socioeconomic levels, different educational levels, and all that stuff is really important. But two things I would say is make sure that your organization reflects a diversity of people. So sometimes it's as simple as making sure someone in their 20s is connected to your organization. So you could be like, we're not saying that no more. Let me know what's trending, because they know. And they'll help you to make sure that your content is really relevant. The other thing I say is, the truth of the matter is I've been working in public health now for like 10 years, but my background is in communication. And so I try to always be a layperson. Like, if the information is written at this high level, if you're using jargon, if it's, what has become very common to you, before the pandemic, no one was saying words like pandemic or epidemiology or immunocompromised, all of these kinds of words. You have to always be a layperson, no matter how long you've been in public health, to ensure that your content is easily accessible, easily digestible, and relevant and interesting.
Yeah, no, I definitely agree with LaToya, and I think again that the pandemic really shed a lot of light on how we are communicating with our audiences. And just for example, there was a young lady, she's young at heart, she's in her 70s, who had reached out to me because she had heard one of our subject matter experts speaking about COVID, and he kept using the term comorbidity, and she didn't know. You know where I'm going with this, LaToya. She didn't know what that meant, and so she reached out to me, and so she said, baby, do I need to be worried, about COVID? Because now I don't have a comorbidity. My doctors never told me I had a comorbidity. I got a little touch of sugar, and my blood pressure is high, right? So the terminology did not connect with that audience. And so, hoping her to understand that those things, her touch of sugar, is a comorbidity. That's, her diabetes. And so I do think that it's important that we acknowledge that the folks that we are trying to reach, especially if we're using focus groups, the reason that we're doing that is because their lived experience matters, right? And so as we are framing, communications models, it doesn't make sense to invest in, funding and time and the creative process if it's not going to reach or have the impact on the population that it was created and designed for. So again, just ensuring that we are taking feedback from the audience, and that we do have subject matter experts that are a part of those communities. You may have a staff of 2 or 3, but you may have to bring on consultants that are connected within those communities that really understand some of the nuances to ensure that the campaigns are effective.
In the
Jose?
case of Siena, I used to say that we have the benefit of having our own focus groups because we come from so many Spanish-speaking countries in the company with so different ages, from 20-somethings to 70-something from the chairman of the company, that every time we come up with some ideas, I say, let's discuss it among ourselves first and see how it comes. Of course, we have the focus groups and everything, and I'm always surprised, that how diverse we are and how what we believe is a simple, straightforward call to action has so many meanings for people. It's just mind-boggling. But in our case, we have, as I was mentioning before, and I can elaborate a little bit on this, we have the benefit of having a 200 plus affiliate networks in radio nationwide, obviously for Hispanics, Hispanic markets, So what is interesting to us all the time is that every time that we produce anything, not only for big campaigns, but also on a daily basis about the needs of our community, we have instant feedback. And that has been so important for us. I also, this is not a plug, but I also do this radio call-in show on Thursday, 2 p.m., Bienvenidos America. And, the community, just calls us and tells us this. And when we are right, they tell us that. And muchas gracias, Dios los bendiga. When we are wrong, they already clear that we're wrong. So we have this benefit that we feel that we are in tune with our community to the extent that we're able to not only do the social listening, but doing the actual listening, And usually the people who call to these shows are either the most passionate about something or the people who are in most need of something. They need resources, they need information, they need advice, they need guidelines. We have 2 PhDs, people who are dealing, for example, with mental health issues. I deal with the issue of immigration and adjusting to life in the USA. And so you know when somebody tells you that there's really a big need of information, and that sometimes they are lost in this ocean of different conspiracy theories and misinformation and myths and whatever, that to have some voice in which they can trust is so important. But at the same time, I think we should not overplay the importance of social listening, because if we only address what our community wants to know or believes they want to know, we will be doing a disservice. I think as health communicators, we need to strike a good balance between what our community wants to know or believes they want to know to what we believe that our community should know and needs to know. And I think to the extent that we do that, to the extent that, yeah, okay, probably nobody wants to hear about double masking right now, but you need to know that, double masking works. So if we know that we need to do it, we need to do that. I think this balance, this dynamic is playing out every single day within our company, and I hope we're doing a good job for that.
And it's interesting to me that all of these questions so far, we're about to shift gears and talk about COVID. We got the most questions about COVID. So we'll talk about COVID in a minute. But there seems to be some common themes here as we talk about developing messages. We've talked about, making sure that we're evaluating those messages. And I just want to say, I mean, the engagement in the chat has been amazing. There's some other resources. Someone has shared a resource for the guide for participatory evaluation methods. And so we'll make sure that if you're not following the chat, that we pull these out, and maybe we can send these out after the webinar, some of the things that have been placed in the chat. But everything seems to come back to representation, to respect of people and their lived experiences. And it sounds like sometimes we make things way too difficult, right? We want to create, all of these, groups and meetings and tools to evaluate messages. And the common theme amongst our panelists, at least, is, simply asking the people who the messages are intended to go to. And so I think we take that for granted. And I also wanted to point out what Kim mentioned about images. I don't know about you all, but I've been in rooms where if we have to transcreate something, where we have to do something maybe in English and in Spanish, that the idea is that, well, you just use the same thing, translate it, and you just stick on what your version or your idea of a Hispanic Latino person is for the purposes of that material, and having to say, wait, that's not quite it, right? And so I think the images are just as important as what we do when we create the rest of the messages. And so as I mentioned, we did take a lot of questions. And one of the questions that kept coming up is this idea of, kind of lessons learned from the COVID pandemic. And so we can't go any further without discussing it, or all 174 people, well, minus us panelists, will hang up and say, no, thanks. And so we know that it's very clear, especially lately with the vaccine rollout, that there are some disparities as it relates to the COVID pandemic, as it relates to disease burden from and serious illness from COVID. And even now we're seeing with vaccines, I don't know if you've turned on the news for the last 2 days, you've seen a lot of talk around vaccine hesitancy. And I know the people who are on this call are like, well, we've been talking about this for months now, and y'all just put it on the news. But, these things are out there. So I want to hear from our panelists. What are your thoughts on how all of this is being communicated, and the potential effects of this communication on public awareness of health disparities on future health efforts? I mean, we're setting the stage here, how we're handling COVID, things that we say or we don't say, is affecting how we go forward in public health and health communications, and even participatory research moving forward. And so share your thoughts on that. And I'm going to go back to Leisha for you to start our conversation.
Nothing about what we have experienced with COVID from a communication perspective caught me by surprise. What it did do is shed light on quite honestly, on the ineffectiveness of our communication strategy in terms of speaking truth about health disparities, access to healthcare overall, period. And we have seen this model so much in HIV. But what was so interesting is that when we talk about HIV, we normally are talking about a specific population or a subpopulation within larger racial or ethnic groups. But with COVID coming on the scene, now we're talking about everybody. right? And so then it truly became revealing about some of the ineffectiveness of our messaging. We saw early on where our media was specific about reporting data and deaths, but wasn't telling the stories of that there's a face behind those numbers, that looks like your, as Kim has mentioned, mom and grandma, that's somebody's child. That number is connected to a family and a community. And I think once they finally got it, it began to raise more awareness about why these prevention strategies were so effective, about, you know, wearing a mask, social distancing, and so on. But I also think that I'm hearing more now that I wish we would have heard early on around the issues of access, medical mistrust, the fact that when we talked about essential workers, we are talking about folks from many racial and ethnic communities that don't have this luxury that we're saying about physically distancing, right? Because of the type of work that they are doing. And I can say, even personally during this process, it was very difficult for me to have to acknowledge that I have privilege. And boy, you know, like as a Black woman, oftentimes I'm like, see, these are the things I don't have privilege for, but I got to work from home, right? So then I got the opportunity to choose when I would be around people or not. That was a great privilege and still is in the midst of a pandemic. There are two things that I saw around messaging though that were very heartbreaking for me. Early on in Georgia, we saw a smaller rural community that was experiencing two super spreader events, and they both were, LaToya, know where I'm going with this, these were both Black funerals. And when I listened to how it was communicated about these super spreader events, it was very disrespectful to the culture of that population, right? And so when you're talking about Black funerals, the use of the term homegoing is a celebration, right? So we may be in somebody's church for 5 hours, all closed in, pulling out the fans. And so when you say to you say to that community, you shouldn't have done that, don't do that, this is causing more deaths. What it does say is that you don't respect that this is a part of our culture and ritual. Instead, let's look at assessing how we might have to do this different during a pandemic. That does show respect, you know, for that audience or for that population. And then the final thing that I'm gonna say, and I don't, if my mom is listening, I'm telling her, I'm telling all her business. She know this, but my mom, you know, she's a nurse. She's a nurse that's over the age of 65, and she's a nurse in assisted living facilities. And with so much knowledge that she had about COVID, she had made a decision that she was not getting a vaccine. And that came from culture, right? And so, like, you know, we have been through the Tuskegee study. You're not going to get us a second time. We're going to wait. We're going to let other communities go first. And let's see what, you know, what the vaccine does for them. And then we can have a conversation about getting vaccine as a part of Black communities. And so what I had to share with her was your perception, that's your reality, and that I'm gonna respect that, right? You're watching everything that's happening in the media, you know, around it, and the fast track about the vaccines, and we did a poor job of helping people to understand about this fast track process doesn't mean that it hasn't gone through the same process that other vaccines that take multiple years go through. We did a poor job around that, but I had to make it personal for her to say, if you don't have this vaccine, knowing the environment that you're in, let's talk about the risk. And with your risk, let's talk about what that means in terms of family. And there's a greater risk that we will be without you. Now, it is your decision. But the reality is that we do need you to be around. Now you can make your own decision, but we need you to be around. And so that tactic worked with her. And then once she had her vaccine, I asked her, I said, will you share your story? Because there's some other folks that are in the same position that you are in. But when they hear that you had your vaccine, and you tell your story, it's going to be the influence for them. Girl, you have now become a social media influencer. And what was so beautiful about this, and Belinda, you've heard this story, was she called me and she said, something's wrong with my phone. I keep getting this bing, like a bell sound. And so I heard it while she was on the phone with me. And I said, oh, those are direct messages. And when she understood how to, open the messages, she had people from her church, from old classmates, from other hospitals that she had worked in. They wanted to know how she felt, what made her decide to do it, and that whole process. So even looking at the communities that are impacted, utilizing them as our communications experts, because again, that became her lived experience.
So I just want to say that, Leisha, as you were talking, some of what you were saying, I was like, is she reading my notes? Like, did she just said everything I had to say? But there is a small point of where we really diverge, and I want to talk about that. So I was one of those folks who planned a virtual funeral for our great uncle who passed on, and I do want to talk about a specific COVID-19 vaccine resource. But one of the things that I just wanted to comment and say is that when it comes to the communications around COVID-19 vaccine hesitation, I feel like media and culture is still leaning so heavily toward the negative that it's almost getting to be a little bit insulting. So when you hear this talk about African Americans' response to the vaccine and a Tuskegee effect, what I'm starting to hear constantly is, oh, Black folks are stuck in the past and they don't know what's good for them and they're going to get left behind, yada, yada. And I feel like that's an okay first thought, but it's really insulting. It doesn't really honor the fact that African Americans across the country are collectively seeking simplified and accurate information about how the vaccine was delivered. Like, if we framed it like that, it's so much more respectful, because honestly, suspicion and skepticism are life-saving measures that have saved our lives as Black people in this country. Like, we ask questions and we investigate, and suspicion literally it's a protective measure. It's literally a part of our culture, and it has to be honored. And so I would like to hear in the news, as people talk about vaccine hesitation, being more like, oh, Black people are erring on the side of caution in order to further investigate the efficacy of the vaccines, but that's not how they talk about us. And I feel like that's a problem. And so I will say that I was very proud of my mom, who went and got the vaccine. And when she went and got it, I was like, Mom, you got the vaccine, but did you read about it? Are you sure you're informed? Which one did you get? How many more days before you have to get your second dose? Do you know what you're supposed to do? And she said, well, you sent me that toolkit. And so I'll tell you now about the toolkit. So I partnered with the Center for Black Health and Equity. We partnered with the American Lung Association to develop a toolkit that would really honor the Black community, demonstrate the way in which African Americans have been a part of the process for the development of the vaccine all along, even from many years back in history, inoculation and everything. It's really cool. You've got to look at the vaccine. I mean, look at the toolkit. But when we decided about our approach, we were very specific that we were not going to say, don't get left behind, don't be stuck in the past. What we wanted to say was, your suspicion has saved your life. And so be suspicious. Here's the information that you need to ask the questions that you want to ask. And inside of that toolkit, we talk about the kitchen table Q&A, like what you ask in your kitchen, in your kitchen with your friends, like, I'm gonna wait to see if you get a third eye and then I'll take it. So we just wrote it like that in the Q&A. I'll wait until you get a third eye and then I'll take it. And what's the best response for that kind of a question, you know? And then there's, you know, comments and responses for faith leaders who may be asked when they're in our church communities, because we know that our faith leaders are basically our community organizers. That's where we get a lot of the information that we need. So the conversations that are happening inside of our churches is really important. So we want to equip those community leaders to have those answers, but we don't ever want to disrespect our culture. We want to honor our culture. We want to frame everything that we say to one another with respect and dignity and positivity, because I think that that's going to get us a lot further. That's going to help build the trust that has been lost in our community. And so it was really a huge pleasure of mine to put together the toolkit, but I still feel like before you make moves, make sure you know everything that you need to know. How does the mRNA vaccine work? How were the vaccines developed so quickly? Like, all of this information is in that toolkit. It's called the Better For It Toolkit, and you can get it at lung.org/vaccine toolkit, or I'll send a link in the chat box.
Yes, please put the link in the chat box, LaToya. I want to keep the conversation going. Jose, I know you have something to say.
Yeah, I was going to say something. Yeah, you know, I see this at a macro level because, you know, you need to recognize the existence of a problem to solve it, right? So when the comparison between what happened until January and now is so striking to me as a foreigner that, you know, I can avoid talking about it because, you know, before January 20th, the disease did not exist as such. The pandemic pretty much did not exist in the official world, right? And then you see the change. And I think that has that has a huge impact as to how we should conduct our campaigns regarding COVID, you know, because I truly believe that the fact that now is recognized as a serious issue, disparities, you know, in many ways, disproportionate impact, I think that plays a major role as to how we shape our own messaging. And the other thing is, if there's not a complete alignment between political leadership, and I hope I'm not being political leadership, and then the medical community in terms of what should be said, there's so much that we can do, but we won't have the impact that we can have. So to me, it's very, very important that those people who are, you know, in the forefront as political leaders have the right messaging, because if not, they will make our jobs so much more difficult. And to the extent you see the alignment in recognizing the problem, in addressing the problem, in figuring out how to the next steps and putting the empathy that now we're seeing in terms of that messaging, I think that makes a huge impact as to what we can do, because no matter how big campaigns we're conducting right now, that will be small compared to the, you know, constant exposure that our leadership has every day in our lives. And yes, I agree, we need to find the trusted voices, but at the same time, those trusted voices have to have, you know, everything behind them to make sure that, yeah, that we are reducing the hesitancy, but we make to make sure that the vaccines are there, that if you live in a remote community, that there's a refrigerator that can store the vaccines, and you create this general perception that, yeah, now we care, and now we're taking all these small steps to address the needs and the disparities in distribution. If not, communities will still continue to believe that, you know, that there's not a real care for them, and that will continue to feed into the mistrust and, you know, the African American mistrust for several different reasons than our distrust, but they will continue to be there, and that won't help solve the problem.
And, you know, what's interesting is that this idea of mistrust and disrespect culturally goes beyond, it touches multiple communities. And so it's something that I think it's huge for us to tackle as communicators, but also relevant that it really doesn't matter the communities that people belong to. It's what are we doing to make sure that we're treating them with respect, we're giving them the information they need, and we're doing so collectively. I mean, I feel like that should have been the theme of this discussion. And boy, we are really going through time here, and there's so much more that we want to ask. I think Kim, I know that you didn't get a chance to speak. Did you want to say anything here, or shall we kind of keep going in our discussion? I don't want to silence your voice.
Oh, sure. So I just wanted to add, there's the historical piece for sure with Indigenous communities, but there's also the current systemic racism in the medical community, and that is also adding to that hesitancy. And but we were really surprised. There's been some research coming out. There's a report out from the Urban Indian Health Institute where they did a survey, and 74% of Native people that they talked to planned on getting the vaccine. So we're actually seeing a lower level of hesitancy than we anticipated, which is great. Our challenge that we're seeing is how do you get it? And again, like all of the other panelists have said, how do we get that accurate information out? So really our big challenge is how do you get the vaccine? And there's been, I think CNN picked it up. There's been some stories in the media about how tribal communities are actually farther ahead vaccination wise. And that comes from the Indian Health Service, an established system that they could activate in order to get these vaccines out. And also tribes have sovereignty on how they can select the people who get the vaccination. So they can choose within tribal nations, they can prioritize who gets it. And so that has been really, really effective. So I just wanted to add that perspective.
Thank you, Kim. And again, these are all very good learning lessons. So I want to make sure we have time for questions. One of the things that has been kind of coming through in the chat and also this conversation are tools and resources that people are using to do the work that they're doing. And so we have some of that in the chat, but I'm curious for each of you. And this question, I'm going to start with you, Kim, but I actually would like each of you to answer this question. Do you have a favorite tool or resource or template that you use while you're doing this work? And if you've already shared it, that's fine. But I think that I get the sense from those who are watching that they're interested in hearing what your one favorite tool is. So Kim, we'll start with you.
Well, it's tough working because there really isn't a lot out there as far as template wise, especially because Indigenous communities are so diverse. But I mentioned photos. There is, I think it's through iStock, the Navajo Nation actually did a COVID photo shoot. And they did this at the height of, if you recall in the news, the Navajo Nation was hit really, really hard with COVID. And they did this photo shoot in the height of it because of how important that was for that representation. So there's a lot of Navajo Nation members with masks demonstrating social distancing, and those photos are free out there. The caveat is it is focused on the Navajo Nation, and there is a lot of diversity within tribes. So if you're trying to communicate with other tribes, that's not necessarily going to work. Great, somebody put a link. I see that in the chat. Thank you very much. We also there's a CDC Clear Communication Index where you can run products that you've developed to make sure that it's plain language. That's a really great tool. And then for photos, we also use Native stock and Alaska stock. The challenge that we run into is so many photos of Native Americans are historical. So we've actually had to develop our own photo library. We have a photo library of about 30,000 images of all different situations and ages and all that good stuff. So if people are interested in that, I think my email address is going to be at the end. So you can contact me if you're interested in that. And then I'll just add one more, a newsletter that's really good is We Heart Health Literacy. I think you can just Google it. They send out, I think it's weekly tips on plain language really short, concise newsletters that can be really helpful just in translating scientific information and complicated health information into really simple language. So those are a few of the ones that we use.
Thank you, Kim. Jose, your
Yeah,
favorite tool?
I'm not sure if it's necessarily a tool, but when we were dealing with the issue of health disparities and health equity, we tried to figure out how to have the most impact in being the most granular that we could be. I'll put out a couple of examples. You know, we started doing some videos about how to make your own mask at home. It was pretty popular, you know, because of the YouTubes and the impact in our digital platforms. And then we did something about how to clean the mask, how to put it on. And it was amazing because, you know, some physicians called us and told us, oh, that's great. That's everything I've seen, you know, either in English or Spanish. Can you translate it for us to English? Because we might want to use it here in our clinic. And we did that. It was broadcast in the Mexican consulates, you know, for some time, because then they kind of closed down. For the Mexican people who went there, millions every year to, you know, get their birth certificate or whatever. So we decided that we need to diagnose exactly how those disparities manifested. So we did, for example, specific guidelines for farm workers, you know, meat packers, for supermarket workers. You know, what about if you use a bus, you know, because that's, you know, instead of your own car, you know, that kind of give you a sense at the socioeconomic level. Okay, then what should you do about getting protected from COVID if you use a public transportation? So we felt that being very granular in our approach to specific needs of specific communities, that was important. You're undocumented and you're afraid that if you get tested, you will get, you know, booked, and they get your information. Okay, this is what you need to do. This is how you need to approach it. Now, if you're concerned about the fact that you don't have health insurance, well, you should know that vaccination is free. So we did very specific executions and deliverables in terms of addressing specific needs. So I'm hoping that we're having some impact because we believe we give them the tools and the resources they need, the information they need for very specific needs, and that's the way we approach this issue with our community.
Thank you, Jose. Leisha, favorite tool or resource?
I am a storyteller, as you have probably already figured out. And so literally my favorite resource overall is just people being able to tell their stories, creating videos, telling that story. I made a decision to do something I have shied away from since I started my career almost 30 years ago, and that's participate in a clinical trial. And so now I'm actually a part of a vaccine trial, a COVID vaccine trial. And I did that just out of need from conversations that I gathered, you know, from my community. And I'm sharing my video blog of my experience through this process. And so, and I'll put in the chat, that's on my website at leisha.org. But another resource that I also use is from the Black AIDS Institute, and their website is blackaids.org, and I'll include that as well. And it's just a whole host of materials and fact sheets and things like that, webinars that they have gathered from the prevention trials networks, things that they have done as well. And it is a great tool to use. And I have a few fact sheets that I ended up creating for COVID from those types of conversations that I've had with, you know, elders within the community who needed something that was at a level that they could understand. So those are the resources that I use.
And LaTroya, thank you, Leisha. LaTroya, favorite tool or resource?
I don't know if I could really provide a lot of guidance here, but I noticed in the chat some people were saying, you know, I'm not a communications person, you know, where do I start? And as a person who knows to use InDesign and Photoshop, I will tell you that the 20-year-olds have put me on game when it comes to Canva. And I know this is not really directly to public health, but I'm telling you, Canva is where it's at right now. It makes designing and executing your social media content, creating digital content really simple. Now, I will say there is a photo function, in there, and we had a real hard time trying to find Black female queer images. So they're not quite up in that regard, but it does simplify your work. So that's the best I got for you.
Thank you, Atoya. And so I have one final question, and that's because we kind of had this question come up a lot. We had quite a few people who are new in their career that have joined this webinar. And so I just want to ask, for those who are recent grads, what advice would you give to those people who are either recent grads or just starting out in their career, as they kind of go out and do this work in health equity and disparities? So I think because of time, I really want to get to other questions. I'm going to only choose 2 people here, and those 2 people will be Kim and Leisha.
So I'll be brief. 2 things that I would say for folks starting out to always remember: the message matters and the messenger matters. And so when you're creating any type of communication tools, centering those 2 things will have a much greater impact at being able to reach the audience that you desire.
And
Thank you, Leisha.
I would also add, use your voice. For those of us who've been doing this a long time, we want to hear what you have to say. We want those new perspectives, those new ideas. We don't know everything. But also kind of on the flip side of that is you don't need to reinvent the wheel. You don't have to start from scratch. We're out there to help you. So ask questions and, just don't be afraid to find out what you need to know.
Thank you both. Okay, so we got quite a few questions in the Q&A. We won't have time for all of them, but we will ask a few, and then we're going to kind of let each of our panelists have kind of their final say and tell us what they're working on. And so, Terry, I know you've been monitoring the chat. Are there 1 or 2 questions we can pose to the group that we haven't touched on yet?
Yes, and I do want to say that we will send an email to all registrants with links to the tools and resources that have been mentioned during the webinar. So don't worry if you missed them in the chat. So one of the first questions that someone asked is that the challenge that we have is people blame disparities on personal choices, wrong perceptions, for example, laziness, not following the rules, and even blaming genetics. And this is definitely a barrier to communication. And the questioner would be interested in hearing members of the panel address this.
Sure. I have been the poster child for decades talking about the infrastructure, our systemic infrastructure around healthcare does not yield favorable outcomes for many racial and ethnic populations. But what happens is we begin to look at personal choices. So when I saw this question in the chat, if I could turn a cartwheel, I really would have, that somebody else sees this as well. But many of our personal choices are also influenced by the systems that we are a part of. And if we truly want to see positive strides come for health outcomes, including COVID, we have to address the root problems. And that is our healthcare systems and many of the infrastructures that are created for service delivery that will never yield positive outcomes for many racial and ethnic communities.
Thank you, Leisha. Terry, any other questions?
Well, there were a number of questions related to plain language and obtaining diverse images. And I think we'll address those by sort of compiling all the great resources that people have shared in the chat. Someone else asked why we did not have a representative from the Asian American community on the panel. And I would say, just from my perspective, that we needed to limit the number of panelists given the time we had available and the sort of broad topics we wanted to cover, but the society certainly would welcome the participation of representatives of this community in future programming, including our upcoming annual summit in May, which you will hear more about. So the other question I found interesting is that one of our participants has a physical disability, and she's wondering if there are any good resources for writing about and depicting members of this population. And I certainly think that this is an important community to take into consideration.
Do any of our panelists have experience with that?
I think that's a very important point, because now we're seeing that, for example, we, in all our campaigns, we want to be as diverse as possible. We want to bring people from all ages, sizes, and people with disabilities, LGBT community, and it's very hard. Even though we have access to most of the stock services, for example, when we need images or videos, sometimes we found that we need to do our own thing, because otherwise there's no way we can represent our diverse communities the way we really would like. And also that's another issue. Sometimes these big, stock agencies deal with the stereotypes. And so we find ourselves double stereotyped, not only by, in many spaces, but also in these stock images. Yeah, so I think that's a big issue. That's a big problem. And sometimes it's not easy to resolve, because when you have the resources, yeah, you can do and get the shooting and get the, the talent and everything you need, but sometimes you simply can't do that. And so, yeah, it's something that needs to be looked at, because, yeah, it's impacting the way we tell our stories and the way we want to be emotional and personal. Sometimes we just don't have the resources available for us when we need them.
I agree. I just dropped a link in the chat. I haven't vetted this site, but I did just Google it really quickly, because I think that what Jose says about empathy is super important. I grew up with my best friend, well, my cousin. When we were 5, he was hit by a car, and he grew up as a quadriplegic. And he often talks about the lack of attention given to people of color, especially who are living with disabilities. And so he's always championing his own rights online and on social. And I think that it just takes a little bit of digging when you have that empathy to find the resources that you need to reach your community. And it's really okay to challenge organizations like the ones represented here to do better, because, yeah, so good question.
I would also like to add, so we do a lot of work with the federal government, and we are mandated to ensure that our materials are accessible, and we go above and beyond that mandate. We do checks, and we don't just use kind of the bare minimum software to make sure that our materials are accessible. We do human checks, and we use screen readers and things like that to listen ourselves to make sure that it makes sense. And we have an accessibility expert on staff. So if you, and she is very passionate about her work. So if anyone wants to email me, I can always pass on her contact info, even if you just wanted to, talk with her about the resources that she uses.
Just to give a brief example, if I may, after this webinar, I'm going to be doing some radio spots with some talent in Hollywood. We were so, focused on the idea of diversity that we asked for like 5 different accents in Spanish from people from, Mexico, Central America, the Caribbean, South America, because, we feel that if you do that, communities really get identified, and they, you know, even regardless of the messaging, they say, oh, they care about us, you know, because it's not only Mexican Americans. Yeah, I'm Mexican American, and most people speak like with my accent in Spanish. But no, you know, we wanted to show that we care about you, and even if you come from South America or the Caribbean, Puerto Rico, Cuba, whatever, you know. And I think that kind of minus nuances make a difference at the end, because people know they are really, you know, people care about what they're doing and what's happening to them, and I think that makes a difference.
I think we're almost out of time, but I am so grateful that you each have participated. This has been some great information. We have heard some common themes here. We've heard about the importance of having the right people at the table, of respecting and honoring people's culture, and keeping our communication plain language, making sure that we're evaluating along the way. So this has been some great conversation. I think they will have to do a part 2 because we just didn't get enough. For those of you who are still with us, I think we have the slide up. So all of the email addresses are there, and we'll also send out, I think LaTroya's email has a different email, but we'll make sure we send out all of the emails to folks after this. And thank you so much to our presenters. Before we leave, I just want to give each of our panelists who volunteered their time here to help us, each one an opportunity to kind of tell us one last thought or something that you're working on that you'd like to share with the group. And I think I'll start with Leisha.
I just thank West Staff for letting me be a part of this. This has been such great conversation from start to finish. Seeing the questions in the chat made me feel like that folks were engaged, that we had something to say, and that you received it. That's what helps to make a webinar a success, in my opinion. So thank you for contributing to the success of this discussion.
Thank you. Jose, any final thoughts?
Yeah, briefly. I used to be a traditional journalist for many, many years. I was a bureau chief here in Washington, D.C. And I left that world. And believe me, you know, just working on health communications has been so meaningful and relevant for my life. I really feel now that I'm making some difference. Is, you know, forget the interviews and the traveling abroad. This is the fact that I feel that I'm making a little bit of a difference in the life of our audience, our community, now that is more needed than ever because of what's going on. You know, that's really important. So if you're in this field, it's for something, and really it's a great time to be here and trying to make a difference in people's lives.
Thank you, Jose. Kim.
I just would also like to thank everyone, and just looking at the chat, and you all have inspired me. So I hope that some of the things that I have said have been helpful. And I'm with Jose. You know, I started out, my degree's in technical communications, but I started out in marketing at a publicly traded ode to capitalism, and I switched over and have never looked back. I'm so thankful that I get to do the work that I do, and I hope that you all who participated in this continue to do the work and do great things. Thank you.
Thank you, Kim. LaTroya?
So if I might just give 2 plugs. One, Friday is the last day to register for the State of Black Health National Conference. It's awesome. If you work in public health, if you are one of the only few people of color working in your office, and you just need to be around the people who can talk about these issues in the context of racism and social injustice, State of Black Health is everything. It's unlike any conference ever. It's virtual this year. Register stateofblackhealth.com. But also, I started my career in the agency world, and I did have an awakening where I said, you know what, meaning matters more than money. And when you move into public health, you still love the comms side of everything, but sometimes you lose the connection with the other creatives, and you don't always have the same kind of support. You might be a one-man show. And so we were in the very beginning stages of launching a membership organization called Comms Noir for social impact communicators of color who are interested in finding that connection. Drop us your email address at commsnoir.com, and we would love to talk to you a little bit about what we're building.
Great, thank you so very much. And so I just want to say it has been a privilege and an honor to have each of you here. I am always amazed at the brilliance that we have among us. Just, I mean, each of us are connected. I would encourage our participants to connect with folks on LinkedIn and by email. Let's keep this network going. It's important that we support one another. I'll plug Comms Noir as well. I'm excited about the launch. So yes to that. And I'll stop now. Terry, I don't know if you have any final thoughts from the society before we let everyone go on with the rest of their day.
Well, I thank you everyone for participating, to all of our panelists and to the participants for the great conversation in the chat and the wonderful questions. We will, as I mentioned, we will follow up with an email to all registered with links to tools and resources. And I encourage people who are not members to join and to stay tuned for information on our annual summit, which will be held on May 13th and 14th this year. Thank you.
Thank you all. Have a good rest of your day.
Thank you.
Bye.
Gracias.
Bye.